My name is Illana Goldberg, and I'm going to be talking about the morality of cosmetic surgery based off Margaret Olivia Little's article called Cosmetic Surgery, Suspect Norms, and the Ethics of Complicity. In her article, she decides to focus on the appropriateness of cosmetic surgery in terms of how it perpetuates social attitudes and norms. To explain her argument, Little gives 3 different cases of people requesting cosmetic surgery and tells us which cases we should be worried about. In case 1, double chins are the social norm in a society. One man has just one chin and is not bullied or treated differently for it, but is still self-conscious and asks for double chin surgery. In case 2, a boy is constantly bullied for his ears that stick straight out. The harassment gets so intense that it affects all aspects of his life. He stops going to school, can't stop crying, and has started wetting the bed, so his parents finally agreed to talk to a surgeon to fix this. In case 3, a black woman tries to fit Eurocentric beauty standards, so she has a plastic surgeon slim down her nose, make her lips smaller, and lighten her skin. Another example that Little offers is a size 8 woman who wants to meet societal beauty standards by getting liposuction, stronger cheekbones, removing a couple ribs, and getting breast implants. I found a couple of other examples, such as double eyelid surgery for people of Asian descent to look more European, as well as rhinoplasty to make Middle Eastern noses look more European as well, further enforcing societal norms. Little argues that in case 1, society is not culpable for the pain the man faces. There are always fads and preferences existing in society, but he's not being bullied, and the pressure only comes from his own self-consciousness. In case 2, we see society having a certain preference, but the society's reaction to the boy are cruel and immoral, to the point where this might be a prejudice rather than just a preference, and in this case, society is to blame for the boy's suffering. The situations in case 3 are completely different because they are rooted in history and everyday life, and the content of the standards is part of an unjust social ideology. As Little points out, the norms of appearance are grounded in attitudes and actions that are unjust. There has been a long history of black people being devalued and white people being valorized. The black race has constantly been viewed as subhuman, and there is something incredibly problematic about the pressure to assimilate and fit European beauty standards. In the case of the woman, while both men and women experience societal pressures about appearance, women are constantly defined by their appearance in a way that men are not. Their safety, occupation, education, etc. all interact with their appearance in a way that makes society culpable for their suffering. Little then goes on to discuss whether it is ethical or not for surgeons to allow these kinds of surgeries. One view is that it is not a surgeon's place to pass judgment on a surgery, and just because they perform a surgery does not mean they agree with the values behind it. However, she says that there should be some sort of moral hesitancy behind this. Little says the covenant doesn't have to do between the patient and the surgeon, but with the surgeon and the suspect norms and practices themselves. We are complicit when we promote, endorse, benefit from, or practice norms and practices that are morally suspect, and when we are complicit, we end up contributing to the unjust system of social norms. However, it is important to keep in mind how intense the suffering of the patient is, regardless of suspect norms. I wanted to relate Little's argument to something we've covered before, enhancement, as things to keep in mind when thinking about cosmetic surgery. One main question about enhancement that is often brought up is what the proper aim of medicine is. Is it therapy, which is restoring or promoting normalcy, or is it enhancement, which is making people better at things? What would cosmetic surgery fall under? Additionally, if it is enhancement, we might be better at things, but are we necessarily better off? Little does mention that there is often deep, genuine suffering behind the desire for cosmetic surgery, so maybe the added confidence that cosmetic surgery provides really does make us better off. Lastly, by performing certain procedures in order to make people fit Eurocentric beauty standards better, are we erasing culture? Is what a person looks like even part of a culture? I also want to quickly talk about the effects of improvement, as cosmetic surgery could be considered such. One main issue is that cosmetic surgery causes diagnostic bracket creep, meaning that more things that used to be fine are now counting as problems. For example, the recent trend has been getting Brazilian butt lifts, and the new standard of a normal butt is much larger than it used to be 10 years ago. How does this impact people? Is it immoral to try conforming to societal expectations? And lastly, when will we stop conforming to these societal expectations? Thank you.